Hi guys, welcome back to my YouTube channel. I'm Dr. Fatma Salim. Today I would like us to discuss different types of heartburns. Apparently, people have been mistaking the serious types of heartburn with the normal ones and they end up dropping dead. Esophageal adenocarcinoma. This is simply the cancer of the esophagus. Esophagus is the pipe that links, our throat and the tummy. It is the pipe that takes food down the tummy, and it is the same pipe that takes stomach content outside the tummy in cases of vomiting and all that. This pipe is divided into three portions. There is the upper portion, mid portion, and the lower portion. The upper portion, it is the cervical portion, and then there is the vertebral portion, and then there is the abdominal portion. All these portions are divided by sphincters. These sphincters control the food passage. Okay, so as food passes, it is being controlled by these sphincters. They open, let the food pass, and yeah, so that what happens. Now, if you remember, in my previous video I spoke about the acid reflux, how the acid comes about, how the acid goes back to the pipe, to this pipe, in case someone has a defect, and there are other conditions that necessitates this acid to go back to the esophagus. Persistent acid reflux, leads to a cell change. Now, cell change, this pipe, esophagus, is a muscular a layer that has an epithelium inside, that is covered by epithelium inside, both squamous and stratified epithelium. Now, this epithelium undergoes some cell change in cases of persistent acid. That's what causes the cancer of the esophagus. Guys, if you experience a heartburn, okay, plus these other symptoms that I will be listing down here, then you need to seek medical attention like immediately, because if you delay, this disease does not like, the prognosis is not good when the diagnosis is delayed. So one of the symptoms that you'll be experiencing for people with such a disease is a heartburn, abdominal pain, nausea, vomiting, and these vomiters is usually covered in blood, or covered with blood. A stool that is dark, also covered with blood and all that. But main symptoms that would suggest to you that you might be having, cancer of the esophagus, is when you have difficulties in swallowing. This difficulty in swallowing, it progresses in stages. Initially, one has difficulty in swallowing solid stuff, and then it goes to semi-solid, and then it slowly goes to one being unable to swallow even fluid. Again, someone will be experiencing, a severe weight loss, and all that, loss of appetite and all, but these are late symptoms. Immediately you feel like you're having a heartburn, you have these other symptoms like abdominal pain, you feel like your throat is being narrowed, or it has been narrowed down and all that, like you cannot swallow at ease and all that solid stuff, like you're having issues swallowing solid stuff, then you need to seek medical attention like immediately. Remember, late diagnosis leads to poor prognosis, so you'd rather hurry in being attended to.